Your heart races as you realize the broke. Panic sets in, but don't freeze. Acting fast can protect your health and peace of mind. Here's what to do right now to stay safe. Stop immediately as soon as you notice the has broken. Stop intimate activity to minimize potential risks. Urinate and wash. Both partners should urinate to help flush out bacteria and wash genital area with soap and water to reduce the risk of infection. Avoid douching as it can increase the risk of infection. Emergency contraception. If there is a risk of unintended pregnancy, the female partner should consider emergency contraception. Discuss with your healthcare provider. It's most effective within 72 hours of the break, ideally within 24 hours. Evaluate STI risk. Seek medical advice to screen for STIs. This is especially true if one of the partner has had a high risk intimate behavior. Monitor for symptoms. Watch for unusual symptoms like discharge, pain, or sores in the private parts and seek medical attention if they appear. Communicate openly with your partner. Prevent future incidents. Review proper use. Example, check expiration date, use water-based lubricants, ensure correct size, do not store them in wallet. This helps to reduce the risk of breakage in the future. Stay proactive, stay safe to take control and protect your future. I've talked about high-risk intimate behavior in this video. See it here.